My name's Claire Harrison. I'm a haematologist from London in the UK. I recently attended ASH 2025, and I'm going to talk to you about an exciting combination study in myelofibrosis, which is first of its kind. So it's a combination study with momelotinib, one of our JAK1/2 and ACVR1 inhibitors, with a PIM1 inhibitor, Nuvisertib, which is of interest in the field and has shown activity as a monotherapy and in combination with ruxolitinib. So in this study, we recruited patients who had already had a JAK inhibitor, although they couldn't have already had momelotinib. They had to have a platelet count of over 50 and be anemic with a hemoglobin of less than 10. In the presentation that was given at ASH, 18 patients' data were included, and they were on a fixed dose of momelotinib and escalating doses of nuvisertib. There were no DLTs. And looking at our classical endpoints of spleen volume reduction, at week 24, 50% of patients who were accessible had a 25% reduction in spleen volume. And at any time, that was the same number. Concerning symptoms, also at week 24, 42% of patients, that's 5 of 12 accessible patients, and 7 of 12 accessible patients at any time had a 50% reduction in TSS. So we're also, of course, very interested in what happened with hemoglobin. So there were 16 patients accessible for hemoglobin improvement. 9 of 16, or 56%, had a hemoglobin response. 3 were major and 6 were minor. Importantly, also, the platelet count was stable for these patients, which is really a critical finding. Often these patients have lower platelet counts, which limits our ability to treat them to full intensity. So as a field, we think these are very important and exciting results. This is the first combination study utilizing momelotinib in myelofibrosis to report data. There was also some very nice biological data showing cytokine modulation, which correlated with symptom improvement. And this study is currently ongoing, so it's a useful one to think of for your patients. Thank you very much.